Hello, and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news, and if you have any questions, be sure to join the Celiac.com forum online at Celiac.com. And now, let's move on to the latest Celiac.com news. Vitamin and mineral micronutrient deficiencies, common in newly diagnosed celiac disease. This study explored how adults with newly diagnosed celiac disease often suffer from imbalanced levels of vitamins and trace elements. Researchers compared 59 celiac patients to 59 healthy individuals, matched for age, gender, and ethnicity, and measured 17 vitamins and 10 trace elements in blood samples. They also assessed health indicators such as body mass index, albumin, and hemoglobin to understand how nutrient imbalances relate to disease severity and intestinal damage in celiac patients. The study focused on adults who were newly diagnosed with celiac disease and healthy participants who had similar characteristics. Participants with serious chronic diseases, recent supplement use, or organ dysfunction were excluded to ensure accurate results. Celiac disease was diagnosed using standard medical guidelines, including blood tests and small intestinal tissue examination. To measure nutrient levels, the researchers used liquid chromatography mass spectrometry, a highly accurate method. The study tested fat-soluble vitamins like A, D, E, and K, along with water-soluble ones like the B-complex vitamins and vitamin C. They also analyzed trace elements including iron, copper, zinc, selenium, and calcium, all crucial for health. The findings revealed that newly diagnosed celiac patients had notably lower levels of several important nutrients compared to healthy individuals. These included vitamins A, E, and K2, along with B6, B7, and zinc. Over 85% of celiac patients were deficient in vitamin A, 1/3 were low in vitamin E, and more than 25% had low vitamin K2. Zinc deficiency was also common. Interestingly, the study also found that vitamin B3 and the trace element chromium were higher than normal in celiac patients. About 75% of patients had excessive vitamin B3 levels, compared to just over half of the healthy group. This suggests that some nutrient issues in celiac disease may involve excess levels, possibly due to the body's altered nutrient processing during inflammation. The study also identified a direct link between nutrient levels and the severity of intestinal damage. Patients with more advanced intestinal damage had significantly lower levels of vitamin C, iron, and calcium. Higher levels of the TTG-IgA antibody, indicating immune response in celiac disease, were associated with lower levels of vitamins D and E. Additionally, patients with traditional digestive symptoms like diarrhea and weight loss had more severe vitamin A deficiencies than those with non-digestive symptoms. For newly diagnosed patients, this study underscores the need for more than just gluten removal from the diet. Many patients already suffer from significant vitamin and mineral imbalances that could hinder healing and long-term health if not addressed. It is recommended that celiac patients be tested for vitamins A, E, K1, K2, B6, B7, and minerals like iron and zinc, as these nutrients are most likely to be deficient or imbalanced due to gut inflammation. Untreated nutrient deficiencies can lead to complications like anemia, poor immune function, bone weakness, and fatigue. By identifying which nutrients are most affected at diagnosis, doctors can start correcting these imbalances early, aiding faster recovery and better long-term health outcomes. Some patients may also have unusually high levels of certain nutrients, which could require different treatment strategies. Overall, the study highlights the importance of addressing nutritional imbalances in the initial treatment of celiac disease. Nutritional care should be integrated into the diagnosis and management plan to help patients recover fully and improve their quality of life. To get the latest celiac disease news and information, be sure to subscribe to Celiac.com news. Thank you for tuning in, and see you next time.